Most Manitobans might not realize that we spend 42 cents of every dollar on healthcare. And the escalating costs of the healthcare system means that we can't spend and invest appropriately in education and in other parts of the public service that are important to Manitobans. Sandy Riley makes the point that we spend more money at a higher level on jails than we do on families. So we have to make sure that we are apportioning money properly in the public service. More is going to healthcare than we can sustain, and the conversation around the conference table was clear that we have to look at healthcare reform, we have to look at ways of delivering service more efficiently, and that was the consensus of the group.
Every year, as we moved from a situation some 12 years ago when drug costs, cancer drug costs, were something like 40% of expenditures on physicians. Now they're about 3 times the cost of expenditures on physicians, a change which occurred in a very short time. So we're in a situation where technology push is insistent, where public expectations are continuing to rise, and which all of those expectations have very important political implications. And in thinking about how to approach it, it became clear that one of the most productive ways to do it is to have a thoroughgoing knowledge of what is actually happening at the work face of the delivery of healthcare, and to develop the systems of analysis, information, and innovation that would allow us to engineer the system from the ground up in the most effective way possible in order to make the greatest use of resources that are available to us.
In a 31-year examination of cost escalation in Canada, hospitals went up by 51%, doctors went up by 98%, drugs went up 338%. So in confronting the movement of Manitoba budget commitment for healthcare from 34% 15 years ago to 44% now, one of the most explosive factors in that scenario is this 338% movement of drug costs. And we had a little bit of discussion, maybe I better say I was asserting that a decent technique to address the drug issue was to have a pan-Canadian entity that negotiates price with drug manufacturers, and which would have a research capability that would be so strong that our understanding of drug manufacturing financial statements would be better than their understanding.
The Council will continue to work with the Government of Manitoba to look for efficiencies. The CEOs of our companies are experts in all of those components of business that the healthcare system shares with any other major enterprise. For example, while the bottom lines are different in healthcare, you still have to have a human resource policy, you still have to have a purchasing policy, you have to manage capital budgets. And we continue to work with the government, and we're hopeful and we're actually encouraged that the government now understands that spending at this level is not sustainable. So we will work cooperatively with governments and with communities to offer whatever expertise we can to make sure that we don't lose sight of the objective, which is to deliver first quality services for Manitobans while looking at the efficiencies that any model would require.